Hello, and welcome to Join the County of Santa Clara's live speaker series, featuring our Custody Health and Custody Behavioral Health Department. Today, we're going to learn about the department and their career opportunities. My name is Lil Cottrell, and I am a recruiter with the County of Santa Clara's Employee Services Department. If you have any questions throughout the event, please feel free to drop them in the chat. We will also be recording this event so you can go back and watch it on LinkedIn, Facebook, and YouTube. Before we introduce our speakers, I'd like to show everyone some of the department's job opportunities. So my colleague Ben is going to be sharing the screen with the QR code and link to all the job opportunities. So you can see, you can scan the QR code and you can save it for future reference. And also you can access this website by going to the link bit.ly/SCCCHS. And again, you could save the link and the QR code for future reference. And once you scan the code or go to the website, you will see the web page with all of the different links there. And I do want to bring something to your attention. So for physician recruitments, there is a different application process. You will need to email the physician recruitment team directly. And how can you also do that? If you click on the physician job opportunities link and click on any job that you're interested in, scroll down and the instructions will be there as well. And we can also drop the email address in the chat for your convenience. Now, who do we have the pleasure of introducing today? Our special guest speakers. We have Dr. Eureka Day, the Director of Custody Health and Custody Behavioral Health, Dr. Alexander Chyorny, Medical Director, Dr. Barzeev, Chief of Psychiatry, and Frederick Tatum, Chief of Nursing. So Dr. Day, would you like to please introduce yourself and your team?
Absolutely. And thank you, Lil, for having us. We are so excited to be here to be able to showcase the good works of Custody Health Services. And so I'm going to just give a brief introduction about myself and my background. I'm Dr. Eureka Day, Director of Custody Health and Behavioral Health Services. I come to Santa Clara County with 35 years of healthcare experience in both the public, private, academic, and correctional setting. I have been with Santa Clara for almost 2 years. Prior to that, I was with the prison system where I held a number of jobs. I was the CEO of one of the facilities, one of the largest mental health facilities in the prison setting. I was also a regional healthcare executive where I oversaw all of the medical, mental health, and dental care for 13 facilities. And I also was a director of women's health where I stood up a freestanding and basically a sequestered freestanding women's health care that was trauma-informed and trauma-informed. And so that was a pretty significant, basically a new program for behavioral health and for the healthcare in the prison setting. And then my last job with the prison system was a deputy director of mental health for all 35 institutions. And so here in Custody Health for Santa Clara County, we are doing some tremendous work. We are doing industry standards in the work that we do, and we are very proud of the work that we do. We have about 2,700 we call patients on the healthcare side of the house, and we call them patients intentionally and deliberately. The reason for that is because we are charged and we are the best advocates for the patient's care to include medical, mental health, and dental care. We look at health disparities and we look at the makeup of our patients, and we try to recruit staff that matches the demographics of the patients that we serve. And so we're pretty excited about that. We also have been doing quite a bit of industry work that you will find in any other healthcare system. We are doing medical assistance work, we do trauma-informed work, we see all of our patients as far as what their chronic care diseases are, their population health diseases are. And so we're pretty any other healthcare system that you see, and the work that you see, and the disease course that you might see with patients, we see here in the custody health setting. So we're pretty excited about that. But today we have the opportunity to showcase that good work and to be able to answer any questions. So all of the registrants that are on this call today, we hope that you ask questions. We hope that you try to find information if this is a good fit for you. And this is a career niche. It is a very niched work that we do. And you'll find now that there are several academic institutions, several national conferences around correctional health care. Matter of fact, Dr. Chyorny was a past president of our Western American Correctional Healthcare Services Association. And so we do have these national conferences, and we also have a certification process that folks can actually become certified in correctional health care. And these are like any other certification or license where you need to accrue CEUs on an ongoing basis to maintain that certification. So pretty excited to be here. Hopefully we have the questions for all of the candidates, our panel here today. And I will go ahead and pass on to Dr. Chyorny, our medical director.
Thank you very much, Dr. Day, and thank you, Lil. I am Alex Shawne, and I've been at the Custody Health Services since 2003. I started out soon after my residency, at which I had at the Valley Medical Center in internal medicine. And I have then held a number of different jobs throughout the county, worked in every urgent care, every primary care clinic, worked at the hospital, both in the wards and in the ICU. And I ended up taking this job as a fairly new physician to this field. And it was sink or swim. And I didn't realize that I would be still here 19 years later, but I guess here I am. And this has been a very exciting journey for me. The custody health services, as they existed back in early 2000s, was very much oriented towards acute and urgent type care. Our length of stay was about 30 days, which was kind of standard average for the country. Right now, our average length of stay has grown to nearly 200 days. So as you can imagine, with people staying with us sometimes for years, the focus of care has changed significantly. And we definitely are turning from urgent and acute care towards chronic care, comprehensive care, whole person care, patient-centered care that is much more appropriate for our aging population with numerous chronic conditions. But it's always exciting to work in custody because there's never a dull day, there's never a dull patient. And custody health services is actually a microcosm of health services in general. We have different settings where people work. We certainly have intake, which is similar to emergency department. We have our inpatient units, infirmary. We have our outpatient clinics. We have nursing assessments, which are kind of home health, but also responses to what's called man downs, which is more like you're a first responder on the ambulance. So the variety of jobs that we have in a variety of settings is just incredible. And it's also incredible what we do in these different in custody health services in terms of different programs and different projects. We were one of the first jails to have an HIV clinic on site through collaboration with Valley Medical Center. We brought our entire base clinic to the jail, and they continue to come now more than 15 years later every other week. We also have created a very robust medication assisted treatment program for patients with alcohol use disorder and opiate use disorder. We use the latest treatments, including injectable buprenorphine, for example, and we are the leaders in the statewide initiative for MAT in correctional settings. We also were the leaders in our COVID response. We were one of the first jails to institute a comprehensive COVID response plan, and we've shared our plans with other jails locally and around the country. And we've also published on our COVID control efforts. Um, Additionally, we're one of the first systems to create a reentry center, which is a focus on patients who are leaving custody and how they reintegrate into society. So that was one of the huge achievements, and we are continuing to to our relationship with the reentry center is very close and continues to evolve. Um, so why do we why do I like working here? One of the most important things is my colleagues, my team. We have really unique people who are working with us, people who've come from all kinds of backgrounds, from UCSF, from Stanford. We have our alumni working all over the Bay Area and beyond. And additionally, working with VMC, we are very close with working with our county hospital, and we are able to establish very unique programs. It's also working in this very unique setting, working with custody, is something that not many people experience, and gives us a lot of opportunities to uh, work with different type of uh, in a different type of setting. And then, of course, the main thing is our patients, because every day I come to work, and it's my patients who keep me going. So thank you very much, and I'll pass on the baton to Tatum, Frederick Tatum.
Yeah, how are you guys doing? Fred Tatum, Chief of Nursing Services. My background is in critical care and psych emergency and inpatient psych. Um, as of 2 days ago, I made 6 months here. I really enjoyed this setting. As Dr. Day said, it is a niche setting. Actually did some recon on nursing around this, and the only specialization that is lower, as in nurses come into the field than forensic nursing, is flight nursing, and those are nurses that hop on uh, helicopters and transport organs across the country. So it is really niche, and I just didn't have a very strong sense of that prior to coming here. So I've been a medical surgical nurse, I've been a psych nurse, I've been an ER nurse, um, but I have, in my 15-year career, never worked in a forensic setting, never been in custody services. I've never worked in a jail. It's very niche. It is a great opportunity for nurses, I believe, to care for a population with a very unique set of issues and from very different backgrounds. And you get to see people with healthcare conditions across the gambit, and also healthcare conditions that intersect. Right now, we're looking at complex patients and really trying to reconcile the divide between where patients' medical issues and psychiatric issues, um, kind of intersect and can be overlooked. And I can tell you, in my short time working here, Dr. Day and Dr. Chyorny and Dr. Barzeev, they're transformational leaders. It is an excellent opportunity for nurses to come in and innovate in this setting. I've been given that opportunity, and I would extend that opportunity to any person who worked for me. So my hope is we can recruit people who, are, extremely enthusiastic about working with a population that, sometimes a lot of people may not be excited about working with, and we want to get some new energy in here, and definitely um, you know uh, bring this population of patients the care that they deserve. Thank you. I'd like to introduce and pass on to Dr. Barzeev, our Chief of Psychiatry.
Good morning, everyone. And I have been working in the Santa Clara jail since 2016. And it was a great challenge and a great opportunity to help people that really need our help. As psychiatrists, we know that the jails are actually the biggest psychiatric hospitals in California and in the nation in general. And this is your opportunity to help the people that are most in need of helping. And that gives me great satisfaction to be able to do that. The other thing I really like about working here is the teamwork. You are not alone. You always have a team around you. We work as a team. We advise each other. We support each other. Um, the, it, every job has its challenges, and therefore we really are a big believers in supporting each other, and just keep the good work going. And as Tatum said, there is a lot of opportunity to innovate, to improve, to see how you can give better services and get this system working smoothly. So join us.
Great. Thank you so much, everybody, for all your introductions. So for our viewers, if you weren't able to join from the beginning, we are recording this event, so you can always go back and watch it again from the beginning on LinkedIn, Facebook, and YouTube. So we have a lot of wonderful job opportunities here, and I'm sure our viewers are eager to learn more about them. So, for example, one of our leadership positions, Chief of Mental Health, Dr. Day, is that something that you can speak to?
Oh, absolutely. And this is a new position. We had to vet this through and to get a code assigned to it because it's the first in the county. And so as the Chief of Mental Health, that is a key leader for the clinicians in the work that they do. And so this is a person, again, who will take lead on the deliverables that we have under the mental health program for our clinicians, who include LCSWs and MFTs, as well as unlicensed folks that we are actually helping them accrue the hours towards their licensure. And so this position, again, is going to collaborate with all the leaders to make sure, as Tatum and Dr. Barzeev mentioned, and actually Dr. Chyorny as well, that the healthcare and the mental health have those natural intersections. A lot of the patients that we see that are coming in with chronic care conditions under medical also have mental health conditions. And so, and the comorbidities with both need to be addressed. And so these are folks that work together. We have multidisciplinary team meetings where everyone is at the table. And this is a position that's going to be critical and key. We also have several deliverables under a consent decree that we are under, as well as jail reform. And so that person would also take lead on that. And so this is a very new position to the county. We're excited for that position to be filled. And if anyone has any questions around it, please feel free to reach out. Matter of fact, I have had a couple of meet and greets for folks to just ask questions about it because it is a new position and a new title and a code for the county. Pretty excited about it.
Great. Thank you so much, Dr. Day. That was very informative. So, Dr. Chyorny, can you please speak maybe about some of the physician recruitments?
Absolutely. So currently we have a team of four physicians on the primary care side, as well as two physician assistants. We have openings for three more physician positions. Two of them were just made in the newest budgets that we asked for, because we are definitely expanding our scope of work as physicians here. And the positions essentially include caring for the patients in both jails, main jail and Elmwood, uh, both on the outpatient side in the clinic and on the inpatient side in the infirmary, as well as taking care of patients who are men and women. We are especially interested in physicians who have a background and experience in taking care of women. They don't need to be OBGYN diplomats, but we are definitely looking for somebody who's got an experience in women's health. So those are really exciting opportunities. We've never had this number of uh, codes available, which means that we definitely could be more flexible as to how we design our provider roles. And so we're very much excited in announcing this and in recruiting for these positions. And as Lil mentioned, we do have a slightly different process for physician recruitment. MD recruitment email address, it has been dropped in the chat. And also, if anybody is interested, they're welcome to contact me directly. And I'm Alexander Chyorny at the usual county address.
Great. Thank you so much, Dr. Chyorny. So, Dr. Barzeev, are there any maybe psychiatrist positions you'd like to promote, or maybe just talk about what the day-to-day is like for psychiatrists?
Sorry, thank you for this opportunity. And yes, we have a few openings, and we have a few different settings that are available. We have an acute psychiatric unit, which is comparable to an acute inpatient psychiatric unit. So, and we have the outpatient setting, and a psychiatrist that joins us can be on either of those, and there are people that combine the two, and that's another possibility. Currently, we have 2 NPs and 7 psychiatrists, and we have opening for 2 psychiatrists and 3 NPs. And again, it's our schedules are usually 4 days a week and 10 hours, which might be something that is interesting for people. And I think it's really a great opportunity to grow in an organization and contribute. So as Dr. Chyorny mentioned, there is the physician recruitment email in the chat, and that's true for psychiatrists as well. The day-to-day of a psychiatrist here, I think it's mainly working with very interesting people, very professionally challenging cases that you can definitely learn from and grow while you're taking care of the most, the people that needs us the most.
Great. Thank you so much, Dr. Barzeev. So for nursing, Tatum, Can you please talk about any opportunities you foresee for new graduate nurses?
Yeah. So I think it in part depends on how new of a graduate, that individual is in. Are you fresh out of school with no experience whatsoever, or your new graduate is in, 2 years of experience, and also whether or not there's ancillary nursing experience prior to the RN degree. Dr. Day right now is working on a new graduate program. We have not launched that yet, where we are using the current nursing staff that we have here to bring in and mentor new graduates with marginal experience. Haven't launched that yet. But right now, the working operational definition of a new graduate nurse is 0 to 3 years, and we do hire nurses with 3 years experience, into different clinical nurse specialties. Also wanted to say, between our three facilities, that's North Main Jail, Elmwood, and Juvenile Hall. Oh, this is somebody asking about infection prevention. Okay. Oh my goodness. See, it is. I think I'm gonna end up talking too much. So we hire RNs, we hire nurse practitioners, we hire ancillary nursing licenses, LVNs, LPTs, we hire MAs, and we have opportunities at all three facilities, primarily North Main Jail and Elmwood, for those positions. So what it kind of looks like at these facilities is, at North Main Jail, you're going to work as a nurse in booking intake. That's when patients are first detained or arrested in the community. You're going to be doing that initial screening and health assessment on them, and that is a position that we really like, a nurse with really good assessment skills and potentially a critical care background to assume. We have nurses here who work medical infirmary for some of our patients who are sick while detained. Nurses perform pill call and may go up to the cell units and pass medications to patients and may do an assessment, and it's a really it's an environment that causes you to really hone and focus in on your skills, due to it's not a hospital bed. It's not, there are several factors that could affect that. We have psychiatric nurses on our acute inpatient psychiatric unit. Here at North Main Jail, we have special management units that are step down to our psychiatric units. There are opportunities for nurses there. And most recently, we posted crisis intervention team nursing positions, which will, afford nurses the opportunity to, intervene on patients in acute psychiatric crisis and or acute medical crisis. So those are several opportunities between all three facilities, not just RN, but those ancillary licenses also. We have approximately 15 positions, and that could be, and that's all nursing positions. Um, I hope I answered the question. I can ramble a bit.
Yes, great. Thank you, Tatum. Another question for you. Would you be able to maybe explain if there are any opportunities for extra help or per diem to become coded nurses?
Yes, and we're currently, to become coded nurses, extra help or per diem to become coded nurses.
Correct.
Okay, yes, as in individuals who worked here as extra help. Yes, most recently, we moved 4 of our extra help nurses, 2 or 3, to coded positions. So yes, those opportunities exist, and we definitely, as Dr. Day says, like to home grow our nurses and use people who have experience working with us and who, don't have you know, some who are accustomed to the environment. So yes, absolutely, and that's something we really want to work on, is getting people who worked here before and have extensive experience with us into coded positions.
Great, thank you. And I think Dr. Day, you wanted to expound on infection control?
Absolutely. And as a congregate care setting, especially under the pandemic, we do have a pretty robust infection control team. And again, with some of the new positions that we have brought in our first coded position for infection control. And so that, again, not only for the pandemic and the COVID-19, but also looking at any other contagious disease that may break out in the congregate care setting. And that includes TB, neurovirus, the flus, those type of things. So we're pretty excited about that. And right now we're actually standing up an infection control unit. And so we will be looking for those type of nurses that join that unit. So pretty excited about that as well.
Great, thank you so much. And I see also that the department has openings for MFTs and PSWs. Is there anyone who can speak to that?
Sure. Dr. Barzeev, I don't know if you want to take that. If not, I can.
So I'll explain a little bit, and Dr. Day, if you can add. We definitely have open positions for MFTs, LMFTs, LCSWs, and SWs. The interesting thing about being a clinician, one of those that I talked about in custody, is that you get a lot of areas that you can practice that might be different than in the community. For example, our LMFTs and LCSWs, they are the main care, providing care at the special management units. They have a very important role in evaluating people as they come into jail, in booking, and deciding regarding their housing, where will they be housed and what kind of services, mental health services they'll be getting. They are here. We have a team that is here 24 hours a day. And so they attend to acute mental health crisis. They work they work in a team. So there is a lot of opportunity to practice to the maximum of your capacity, to the maximum of your license in custody. Dr. Day?
Yeah, I think that was great, Dr. Barzeev. And I think the only other thing is we do also hire unlicensed CSWs as well as AMTs. And we have positions here that are management positions that help accrue those hours and supervise the hours towards licensure. So that's another opportunity.
Great, thank you so much for that information. Dr. Day, so if you can answer, how does corrections staff and CHS staff work together?
Well, you know, it's a partnership. And again, we have to work in tandem. We work for the best interest of the patient, but of course, our custody bureau staff, they are for safety and security first and foremost, and that's their charge. But on the healthcare side of the house, you know, we are the patient's best advocate, and we provide that healthcare, medical, mental health, and dental integrated healthcare. But we work in tandem. We have joint meetings. We meet probably weekly in 2 to 3 different meetings. We have multidisciplinary treatment plans where our custody colleagues are also included in those meetings. And so we cannot do this work without that relationship. And it's a very intricate and deliberate relationship. And like I said, I meet with the sheriff's office, I meet with the assistant sheriff. We have joint meetings where I go to their meetings and their captain's meetings, and they'll come to our meetings. But it's an intertwined relationship because simply we have to work in tandem. But it's a very good positive experience. And some of the colleagues in the the custody bureau side of the house are just very well in tuned with the patients that we have, the different diseases, and especially with the mental health patients that we have, because you have to be able to have a certain sort of demeanor with certain populations and special populations. But it's a very positive, and we wouldn't have it any other way. We know that we're partners. We know that we work in tandem, and we respect our lines, but we also respect our collaboration and our integration.
Excellent. Thank you so much, Dr. Day. So I'm sure now that we've learned all about different positions, I did want to also bring your attention that the department also does have some entry-level positions. So again, the QR code that we had showed and the link that we had dropped in the chat, you can find an entry-level position there. So it brings us to, now that we know about all these different positions, how do you apply for these positions? So aside from the physician recruitment, which Dr. Chyorny and Dr. Barzeev had explained also, where that is a different process. For all of our other positions, you may be able to find them if you go to our website, sccjobs.org. And there you'll bring up all of our different jobs, and you can go to the open competitive jobs. If you click on that, and you can find whatever job you like and apply there. One tip that I do want to give when it comes to applying is to make sure that you give yourself ample enough time. So if you have not yet set up an account in the governmentjobs.com website or through sccjobs.org, you may want to go ahead and set up your account and create your profile. Because creating your profile, it's not like a 5-minute process. Your profile is going to act as your application. So you also want to make sure that your profile is as complete as possible. And the other thing is, with a lot of our recruitments, there are also supplemental questions that you would have to answer. And for that, just make sure that you answer the questions completely. And so, for example, you may have a question where it says, please describe your experience doing X, Y, and Z. Please provide your employer's name, your job title, hours you worked, and the dates you worked. So one, please be sure that you do fill in all that information, partly because one, we want to see if you can follow directions. Two, it also helps the analyst who's overseeing this recruitment be able to differentiate applications. So please, again, be sure to be as complete as possible and descriptive. So for example, if I just give a quick example of how you can answer it, the difference. So let's just say taking a clerical position. If I were to just say, I performed clerical duties in my job versus I performed clerical duties such as emailing, typing, filing, et cetera, to be more descriptive is best. And then also, if the recruitment timeline, some people may wonder, okay, from the time that I submit an application, what happens after that? So what typically will happen is when a job closes, and it depends upon how many applications that recruitment receives, it could take up to maybe 2 to 3 weeks to hear something back. Always check your spam folder, because sometimes they slip through and go to spam. So check your spam folder. And if you happen to receive a notification that says that your application was rejected because you don't meet the employment standards, we highly recommend and suggest that you reply back to the email that you receive, because the email will say that if you believe that you have additional information that you may believe that you're able to meet the employment standards, go ahead and reply back right away. Because sometimes it's just maybe the analyst needs a little bit more clarification on something, a little bit more detail. But I always highly recommend replying back right away. And I did want to bring up, just to mention that Custody Health, they do have a specific and additional clearance and related information in addition to what all the other county employees' regular clearance that we have to go through. So yes, so security clearance, excuse me, is required in this setting. So, and then the other thing that I want to bring up is we have the county. And I don't know if you know this is just a little fun fact, but the county is the third largest employer in Silicon Valley. The county really promotes diversity, equity, and inclusion. And we have some really great benefits that we offer. So for example, we offer competitive wage, salary, and calendared increases. We offer competitive health, dental, and vision benefits. And actually, Santa Clara County is one of the few counties that runs its own healthcare plan, which is Valley Health Plan. And that's an excellent plan. And we have 13 paid holidays. We also offer PTO and sick leave. So we do offer both of those. We offer a 457 plan that is run through Fidelity. It's one of the largest companies out there, which is great because you can use that to your tax advantage. And then also one great thing that we also offer is our pension, our CalPERS defined pension. So if you're not familiar with what a pension is, it's basically a continuous stream of income that you will receive even after you stop working. And the amount that you receive will be based on how many years of service that you put in. So the longer you stay with the county, the higher your pension will be. And then another great thing that we offer, which is unbeatable, is if you stay with the county in service for 15 years and are at least age 50 or higher when you retire, you can receive free health care for life. For life. That's free health care for life. And that is just one of the best benefits that you can receive. So that's just some of the things that I also want to bring up. And let's see, is there anything? I did want to mention that COVID vaccinations are required for the positions for custody health and custody behavioral health. So even if there is an exemption request or an exemption, in order to work in any of the CHS facilities, you do have to meet the county's vaccination mandate and up-to-date requirements. And so I know we have a little bit of time left, and I wanted to give the floor to the speakers to see if there's anything else that they wanted to add about the department, any positions, anything. I'll leave it open.
Yeah, I just wanted to mention very quickly while it was on my mind, we are, actively recruiting MAs, and specifically MAs with phlebotomy certification to assist in our infirmary. So if you're an MA and you have that certificate, or an MA in general, that is experienced that we can use, but especially with the phlebotomy certificate.
Oh, that's great information. Anybody else?
And Lil, if I could, we also have
Yes.
2 medical social workers. And so, and one specifically to work with our juvenile population, our justice involved youth. And we're bringing in that position because, again, we're doing the whole person care model, but we're also integrating and trying to integrate our youth into the community when they're released. And so we're actively working to connect our youth, if they don't have a pediatrician already when they come in, with a pediatrician, and bridge that care into the community. And that means possibly having the families meet with the new pediatrician, having the patient meet with the new pediatrician, but that social worker, the medical social worker, will be intricate in that whole person care, bridging care into the community with a designated pediatrician, and hopefully setting up those appointments prior to. So that's one. And then the second, we have a medical social worker that's working primarily with our medication assisted therapies, our MAT program. And so, and this is again critical, that the work that we do in our substance use and abuse treatment, And so that's another position that is highly respected in our field and highly respected in the work that we do. And so we're excited to have that on board as well.
Great, thank you so much. A question for anybody who would like to answer. Is it safe working in the jail?
So I would like to take this one. As a psychiatrist, at least, I've been working in different places, and so far jail has been the safest place I've worked at, because when you work in a psychiatric hospital, for example, the patient have direct access to you. You don't have a trained professional to protect you. And here, if the patients are very unpredictable or have high risk of violence, they will be cuffed or restrained when you come and see them. And you have officers around you all the time. So it's very safe. Sometimes people have the wrong idea that like working in jail is working with very dangerous people, but actually it's a very safe place.
Great, excellent point, Dr. Barzeev. Thank you so much.
If I could piggyback off of that comment by Dr. Barzeev, from a nursing standpoint, it is a very safe environment. Dr. Day may know, or Dr. Chyorny, I don't have a sense of our rate per 1,000 patient days in regards to assaults or anything like that. But unlike the inpatient or psych emergency or CSU environment, the clinician is not required to be the implement in regards to patient containment. So you're not going to be going hands-on as a nurse here. Containing patients. That's not our role and wheelhouse. So compared to every other environment that I've ever worked in where acute psychiatric patients are being treated and those patients in crisis, this is counterintuitively the safest environment in which I've ever worked. And I've been in psychiatric and critical care for over a decade.
I don't know, Dr. Chyorny, if you want to add anything, and then I can give my sentiments.
Yeah, absolutely. And I also wanted to add regarding our patients that despite what some people may think, not everybody who is in jail is a criminal. In fact, for most people, it's a mishap. It's an unfortunate circumstance in the life that brought them to the jail. And most patients are really not out there to get you. They're not aggressive. They're very grateful for the care that they receive, and we have a chance to build great therapeutic relationships with the patients. So in that sense, this is also a really safe place to work.
Absolutely.
Thank you.
Yeah. And if I could add too, and to Dr. Chyorny's point and to all of my colleagues' point, there's a lot of reward in working with this population. We consider them the most disenfranchised and marginalized population or patient in the county. And so there's a lot of reward working with the population. And just being mindful that probably about 70 or more of our patients have been charged but have not been convicted. And so that's a difference too. And so until that happens, they're just patients, and that's how we see them. But we also need to be mindful that we are in a custody setting. And so there is a certain amount of having to, have a heightened awareness of where you are. And also sometimes you have to sort of get comfortable being in this kind of setting. And so there is that element of, we say you have to be comfortable being uncomfortable, because you never want to get too comfortable, and just being mindful of the setting. But I think that for all the respective reasons, these are the same patients that are in the emergency rooms, in Valley Medical Center, in any other system of care in the county. They just happen to be here at a point in time. So I'll offer that. But also, if I could just go back to one other position that we overlooked, medical unit clerks. We are recruiting for medical unit clerks. Yes. And this is a critical position in the sort of the backbone of a lot of the things that we do and the services that we offer. And so we have medical unit clerks that we're putting a designated discharge unit together where they'll be working again with that CalAIM, whole person care, making sure that discharge plans are in place with patients in conjunction with all of the team and the clinicians so that we have that continuity of care when the patients go back into the community. We're also bringing in medical unit clerks that will serve as unit secretaries. And so they will work on the units as unit secretaries, helping keep the organization of the unit going and all of the things that happen around, the needs on a unit, from nursing needs to par levels of different, supplies and things, and just to, make sure that, patient information is ready for the primary care physician and or any other discipline that needs to see those patients. And so that's another piece. And then we also have medical unit clerks that are doing scheduling. We're centralizing our scheduling, so they do a lot of the scheduling for patients. These patients are scheduled when they have appointments with the doctors, for instance, or psychiatrists. And so we have a medical unit clerks that will be doing scheduling as well. So that's another critical position that we're hiring for, and we're pretty excited to bring on board.
Great. Thank you so much, Dr. Day. Thank you. So as we're coming to an end, I would like to share my screen again. My colleague Ben will share the screen again, where we will show a slide with the QR code and the link. And you'll see you can visit this website, which is bit.ly/SCCCHS. And if you want to take a screenshot of the QR code and save that website address, that would be great. And if you've missed anything, we are recording the session. So if you've missed anything, you can go back and watch it on this platform. You can watch it on LinkedIn. You've got Facebook and YouTube. And also, I did want to mention something else. If one of my colleagues can drop in the chat box the link that takes us to our hub. And on that hub, you can find different job opportunities. You can find information about the county's benefits, job application tips, and also you can sign up for job interest notifications. So for example, if there's a position that you're really interested in, but it's not available right now, you can go onto the job interest notification, select the areas that you're interested in. So anytime a job becomes available and we post it, you will be automatically emailed with that information, which is a great feature. So check out our employment hub. The website address, I can also give that to you, is www.sccjobs.org. And if there's anything else, let's see. Just be sure again, set up your account, create your profile, take the time to do that. You don't want to wait till you see a job and it's going to close at 11:59 p.m. tonight and you're on at 10 o'clock and run into any technical difficulties, or it takes a lot longer than you think to fill out. So again, take the time, make your application as complete as possible, and answer those supplemental questions as completely as possible as you can. Okay? And I would like to give a great big thank you to all the viewers who have joined us today. Another quick reminder about the physician recruitment. That's a different type of application process. Again, you will email that MD recruitment email address that we have dropped in the chat directly. And you can check out all of the physician recruitments on the Santa Clara Valley Medical Center website. Okay. And a huge thank you to all of our viewers for tuning in and spending the last hour of your busy workday. A huge thank you to our guest speakers for telling us all about, we've learned so much about custody health and custody behavioral health. Such great information. And a huge thank you to my colleagues who have supported all of the backstage work for us to make this such a successful event. And on that note, thank you again. We have Dr. Eureka Day, Director of Custody Health,
thank you.
Custody Behavioral Health, Dr. Chyorny, Medical Director, Dr. Barzeev, Chief of Psychiatry, and Tatum, our Chief of Nursing. And again, we're always welcome to answer any questions. Feel free to reach out to my team as well, which is DEIsourcing@esa.sccgov.org. We can drop that in the chat as well. So again, feel free to reach out to any of us with any questions that you have about any of the positions, or if you have questions about applying. And again, our employment hub that I mentioned, there is a spot there where you can check out job application tips, test taking tips, a lot of different information. So thank you again. I don't know if there's anything else that anybody wants to say, but thank you again for joining us and taking the time out of your busy day. Have a great day, and we will see you next time.
Okay, thank you, Lil. Thank you, everyone.
Thank you.